How do you know when back pain is serious? So, chiropractors will look after back pain, but there are times when chiropractors need to refer on when it is immediate or it's an emergency. So today I'm going to be telling you exactly what you need to look for, what you need to watch out, and where you need to get yourself off to A&E or looking for further help. As chiropractors, we can diagnose most conditions around the body and the spine, and we can also recognize when there are red flags and where we can't help, and we need to get someone off to urgent help in order for them to be looked after in the long run. I'm Dr. Jeremy Andrews, Doctor of Chiropractic here at West Chiropractic in Surrey. Back pain, it can be very, very sinister at times, and one of the main conditions that we are taught to look out for is something called Cauda equina syndrome. So this is the one where the cord can get compressed by either a disc, and that can put pressure onto the nerves. So we need to be acutely aware of this, and when this is detected, we need to refer this on for immediate action with a spinal surgeon to be able to keep the nerves in place in order for the body to be able to function in the long run. So let me show you exactly what that is just on the demo here. So this is my trusty spine, and you can see here this is the back of the spine. So these are the knobbly bits you feel on your back. This is the side profile here. So very often what we see is we'll see a disc that prolapses out to the side. So if you can see the bulge there, yeah, it just goes out to the side like that, okay? Now, this prolapse out to the side, generally speaking, is our bread and butter as chiropractors. It's gonna cause referral pain down the leg, pins and needles, numbness, tingling. We can get pressure off the disc and the body is gonna be in a much better position. The sciatic pain can resolve. Now, that's what we call a lateral disc prolapse. So if there is a central disc prolapse, and you won't be able to see this too well, but if I open that joint up there and you see the disc, it's gonna pop out of the middle and it presses on the spinal cord here. Now, that's gonna be a problem, okay? It's what we call a central disc prolapse. So if there is a central disc prolapse, then we need to be very careful about how we manage this and how we treat this. So the first thing is we need to ensure that the cord is not compromised, that it's not something that's happened in an acute form. So this is the cord here. Now, as you get to around the L1, L2 area, the cord actually starts to fray out, and we call it a fray out like a horse's tail, hence the name Cauda equina. So Latin name, Cauda is cord, equina, obviously horse. So horse's tail. Now, if the horse's tail or the Cauda equina is compromised with a disc, then that can cause Cauda equina syndrome. So some of the symptoms we would look for of Cauda equina syndrome would be inability to control your bowels or your bladder. So if you're finding that you're getting up and you're like, oh gosh, I need the toilet, and you can't make it to the toilet, that could be a sign that there is some sort of cord compromise there from a central disc issue. If it's coupled with symptoms as well, so leg symptoms, pain in the back, that's something that we'd really look out for as well. That'd be an immediate red flag. I would say, okay, you need to get yourself off to A&E and get this looked at immediately. Otherwise, that can cause some problems with the nerves going into the legs, can cause problems with the motor nerves and sensation through your legs as well. So you need to make sure we get that looked at straight away. If you go into the toilet and you can't feel the paper around your bottom, that's also something to look out for as well. So there's a lack of sensation. So they call it a saddle anesthesia. So if you think about when you're riding a horse, where the saddle goes, so in between your groin, around to your bottom, if you can't feel that area or if it's numb to touch, that again will be something that we'd be looking out for as well and wanting to refer on straight away. But those are the two main big ones. So bowel or bladder incontinence, and then the other one has been saddle anesthesia. So like a numbness around the area. Something that you really need to look out for if you're struggling with lower back pain, if you're getting pain going down both your legs, and you're also getting the bowel or bladder issues or the saddle anesthesia, that would be an immediate referral for us. We wouldn't want to touch anybody until they've been cleared. Now, do we see people who have had Cauda equina in the past? We absolutely do. How do we manage them? Well, it's completely different to how we would manage someone with a lateral disc prolapse or just a mechanical lower back issue. Very gentle, very light, taking lots of precaution around the base of the spine in order for them to feel better. A lot of soft tissue work, some acupuncture, rehab, core stability stuff. So it may be that we've seen people who have had a Cauda equina in the past, they've been cleared by their neurosurgeon, they've had a sign off, they're good to go, we've communicated with the spinal specialists and they're okay to have some sort of conservative work. We then co-manage that patient in order for them to get stability and then go forwards. So if you've had some sort of disc issue in the past, well, what are some of the things that you could be doing in order for that to not come back? So say you have had a central cord issue and you've had a central prolapse, well, how do you make sure that we can get stability in that area? So as I say, only do these exercises if you have been signed off by the doctor, been signed off by the spinal specialist to have some sort of conservative care, then we can start doing these exercises. Okay, so first one I love is just a simple tip and tuck movement, all right? So if you look at my pelvis here, I'm just rotating the pelvis forwards and then tucking it in, forwards and backwards like this. So I'm just making sure my tummy is sucked in. I'm just doing very simple pelvic rocking movements like this. It's very John Travolta in the 80s, right? Saturday Night Fever, is that right? So this is going to help just to take some pressure off. But also, when I'm squeezing forward here, I'm activating my glutes. So it's really important we get those glutes activated. That's going to provide a lot of stability to the base of the spine, take a lot of pressure off the base here as well. So very, very simple, just nice movements through like this. All right, and then my favorite exercise is going to be the dead bug. So on your back like this, making sure the tummy is nice and tight. Now, you're going to lower one leg down, all the way down, all the way down, all the way down, until it gets straight. Now, at this point, your body's going to want to pop that back up. You really want to keep the tension on your back, making sure this is nice and strong through your core, and then coming back like this. Now, that's quite advanced. So I would start with just legs like this. Make sure you cannot get your hand underneath your back, and then very gently just drop the leg down to about 45 degrees, and then come back, and then 45 degrees, and then come back. And you'll start to alternate them here, and then here as well, taking pressure off, okay? So great way to get a lot of stability around the core, helping solidify those discs in place, taking a lot of pressure off the vertebra as well. So let me show you again, just keep it nice and balanced. Going all the way down, and then come back. Remember that long point there where the leg is at its longest, that's gonna be where you feel the most amount of tension. If you feel any pain, just come back, stop, give us a shout, and we can modify that for you as well. So dead bug like this, so back up, and then push it down, okay? You see how my pelvis rotates there? Back up, and then push down. Make sure your head is neutral, not coming up like this. That'll put pressure on the neck. Hands on your tummy if you want. Some people have them like this if you're really advanced, but I'd start to go like this. And then very, very gently. You know, you see here my back wants to come up. Don't let it pop up. Really, 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 really push on here. Feel it on your tummy and then come back. Advanced version would be like this. Opposite hand, opposite arm. So trying to get them right. All the way back. So longitudinal stretch through the body. And then come back here. Same on this side. And then come back here. That's a hard one. And allow you to do that in a different way. So any pain, any shooting pain, any pins and needles, numbness, tingling down the leg, let us know and we can modify that for you as well, taking pressure off that area, okay? As I say, only do these exercises if you have had sign off from the doctor, from the spinal surgeon, from the neurologist. They've communicated with you that you're allowed to start doing some sort of conservative management and just take it very, very, very gently, okay? If you're at all worried about anything, please let us know and we can help with that. Okay, so let's do the bird dog. Okay, so this is gonna be a hip extension, okay, or a hip thruster. It's kind of a reverse of the other one because it's not putting too much pressure, but it just helps to activate the glutes. So I love this because the glutes are great stabilizers of the lower spine. So hands like this, shoulder width apart, shoulders stacked over the wrists, tummy tucked in, pelvis rocking back and forwards, and then very simply just lifting up like this. Lifting up like this. Now, you don't want to go too fast so your body starts to rock on the side like this. You do want to keep it nice and gentle like that. And then come back down, same on the other side. Like this. Taking pressure off. Okay, there you go. So keep my back nice and neutral. Keep the tummy tucked in. You can do 5 on one side to start with. Some people alternate because it helps to reset the spine, helps you to reactivate your glutes. So you really want to tense up the glutes and then lifting back like this. Okay, try and do 5 each side, I would say. All right, so there you have it, how to know when back pain is serious. And please, please, please just take care of those exercises. Make sure you have got a sign off from all the correct medical professionals. You can grab a copy of my best-selling books here. We've got The Secret Cure to Back Pain, How to Avoid a Lifetime of Painkillers and Surgery, and How to Transform Your Back as well. You can grab them on Amazon on the show notes below. If you like the video, please hit the like button. Share this with anybody who's had any sort of disc issues or slip disc issues in the past. And we'll catch you on the next one. Thank you.